Hello, my name's Andrew Messenger. I'm a semi-retired dermatologist based in Sheffield, and I'm going to tell you about our research study on alopecia areata, which is a common disease that causes hair loss. In most people, the hair does eventually regrow, but it can become persistent, and some people lose all of their hair as a result of alopecia areata. Current treatments are not very effective. The purpose of the research was to estimate how common alopecia areata is in the UK and to identify whether any particular groups in the population are more likely than others to develop it. We also wanted to know how patients with alopecia areata are treated in primary care and how many are referred to dermatology specialists. To answer these questions, we used information recorded by general practitioners on over 4 million people from across England. This information is anonymised, so we are not able to identify any individual in the study. So what did we find? During the 10 years of data collection, 6,675 people developed alopecia areata for the first time out of a population of around 4.1 million. This gives around one new case per year for every 4,000 people. In a city the size of Sheffield, where I live, we would therefore expect about 150 new cases every year. It could start at any age, from childhood to old age, but the onset was most common between the ages of 25 to 29, and it was slightly more common in women. When we looked at other population groupings, alopecia areata was more common in people living in cities than in rural environments, and it was more common in those from socially deprived areas. Perhaps the most surprising finding was that alopecia areata was more common in those of non-white ethnicity. This was most pronounced in people of Asian descent, where it was 3 times as common as in the white population. In the year after diagnosis, people with alopecia areata visited their GP nearly twice as often as those without alopecia. And overall, 1 in 4 were referred to see a specialist dermatologist. What have we learned from this study? First, knowing how common alopecia areata is in the population and how this impacts on patients and on healthcare services will be important as we develop more effective treatments, as we will need to know what level of resources will be needed to deliver the treatments. Secondly, understanding why different groups in the population are more or less likely to develop alopecia areata should provide clues to the underlying causes of the disease. For the most part, we can only speculate on the reasons for these differences, but we do have some clues which can help to direct future research. Thank you for listening.